Recording. A very good afternoon to everyone. Myself, Dr. Ritu, welcomes you all once again to the Homeopathy Middle East Zoom platform with the in-depth knowledge of yet another great speaker, Dr. Abhay Talwalkar from Prana Homoeopathy Pune. Our moderator for today's session is Dr. Deoshri Sharma, who has brought Dr. Abhay to this platform today. And she has graduated in 2009 with Bachelor of Homeopathic Medicine and Surgery from DYP Medical College, Pune, and has over 15 years of experience and a postgraduate in public and health, and is currently practicing in Medicare clinics in Mankul, Dubai, Silicon Oasis, and Jumeirah. I welcome Dr. Deoshri and request her to take over the platform, and welcome Dr. Abhay also.
Thank you so much, Dr. Ritu. Good afternoon to all doctors present here today. First of all, today is International Yoga Day. So, wishing you all a very blissful International Yoga Day filled with serenity, strength, and self discovery. As we are all aware, the topic for today's webinar is the use of homeopathic medicines in women's health disorders. And I would now like to introduce our esteemed speaker, Dr. Abhay Talwalkar, who is MD in homeopathy. He's into homeopathic practice since 1992 through his nursing home at Nira and has been able to treat thousands of patients. Dr. Abhay has a huge experience in treating women in their various stages of life. He specializes in using homeopathic remedies for infertility, menstrual irregularities, and for pain management during childbirth. Dr. Abhay is a founder member of Prana, the world's first homeopathy and yoga center situated in Pune, where he is the head of the homeopathy and looks after the women's clinic in Prana. Dr. Abhay has presented at various international conferences and has been recently awarded by Maharashtra Council of Homeopathy with the Lifetime Achievement Award for promoting homeopathy in rural Maharashtra. I would now like to hand over to Dr. Abhay, the man who listens to women. Thank you, Dr. Abhay.
Okay, thank you, Devashri, for that wonderful introduction. And thank you, all of you, for joining this webinar and giving me this opportunity to, share whatever I have learned so far. Because for me, learning never stops. And each patient that comes and each case that we see, each doctor that I meet, he or she teaches me something. So this is the journey I'm going to share with you right now. I hope all of the people who are attending are medical practitioners, and if they are not, uh, anyway, this is a platform where you'll understand how much efforts we doctors take to try and understand whatever you are telling us, because homeopathy is not very, very easy. We really look for the peculiar, the queer, the rare, the strange symptoms in the common disorders. So you may go to a doctor with a common disorder, but we try to find out what is very, very peculiar to you. So let's go ahead and I'll start sharing with sharing my screen now. Can you see this? Devashri, can you see the screen?
Yes, sir, we can see.
Yes, doctor. Yes.
Okay, so let's go ahead and let's talk about what are the things that I have learned so far through my cases. Okay. Um, how does this go ahead now? Yeah, okay. So, why women's health and why holistic wellness? You'll hear a lot about holistic wellness nowadays. So, why are we trying to focus on this? And this was the very purpose why we actually even started one holistic center in Pune. Thanks to Bajaj Auto, who gave us a lot of sponsorship. In fact, they gave us all the infrastructure, and we can still promote homeopathy and yoga and all the allied sciences out there, especially for women's health as well. So the need of the hour is, we think about women's health care because women are vital to our society. they are the ones who are shaping the new generation. So if you treat a woman, you are actually treating a family. Okay. And what has happened is that we have seen a significant rise in their health issues in the past 15 to 20 years. So we have seen an increase in the number of menstrual irregularities, the PCOS, difficulties to conceive naturally, fibroids, tumors, infertility, so many things that we are seeing very common nowadays. Now, why is this happening? Of course, the lifestyle is to blame because the quality, the quantity of food has changed. There is lack of sleep, there's a lot of stress, lack of exercise, a lot of emotional things that a woman goes through. And we all, as homeopathic doctors, know how important our emotional health is and what impact it has on our hormones. So it is very important that we think about this and we treat them in a holistic manner. Okay, so today I'm going to talk about a few cases of fibroids, maybe amenorrhea and PCOS, which is something which is very, very common. Menopausal problems. A lot of women come to us with menorrhagia, metrorrhagia, or fibroids during the menopausal age. Then PMS and infertility. So let's begin with amenorrhea. Now, when we talk about amenorrhea, we know as medical personnel that it is primary and secondary, and we know these definitions. So let me just go forward and tell you that a regular menstrual cycle is really an orchestrated event between the hypothalamus, the pituitary, the ovaries, and the uterus. And there are a lot of things responsible for a healthy menstrual cycle. Okay, anything that goes wrong in this entire loop can cause problems. And what are the things that we are observing nowadays? The most important thing that we are seeing is, why are we getting so many women with a lot of irregularities in the menstrual cycle? Main reason we have found out is that there are a lot of nutritional deficiencies. So a lot of the Now, there are certain typical remedies which you may have used in the past, and I will just share glimpses of those remedies, but I'll try and share some remedies which probably we don't think during PCOS or infertility or so on and so forth, so that it's a good learning experience for all of us. Okay, but this is important to understand that we have to look into the other aspects of women's health also, because otherwise if we just prescribe a very good remedy and if there are deficiencies somewhere else, she's not going to have sustaining results. So iron, lack of iron can cause problems with ovulation. Lack of vitamin C or poor vitamin C can cause infertility. Vitamin B is very, very necessary for all the hormonal balance. There are certain essential fatty acids which are used in production of certain hormones. So if there is an imbalance of these fatty acids, the hormones will not be produced adequately. Cholesterol, this is something which is very, very important, because nowadays a lot of people are detected with high cholesterol and maybe bad cholesterol. And so we need to educate our patients about what is good cholesterol, what are the good eating habits that they can follow, what are the things that will give them good cholesterol, because these are essential for production of hormones. Again, fiber in food is really very important because it removes the excessive hormones that are there in our body. We are eating the kind of food that we get from outside, or whatever we are eating is genetically modified. It contains a lot of preservatives at times. So all these things in our food are promoting secretion of something we call as gene hormones. So in order to get rid of those gene hormones, we need to have fiber in our diet. Zinc. Zinc is another very important element which is very, very important for infertility, for a healthy menstrual cycle. So adequate amount of zinc, chromium, I'll come to all these a bit later as well. All these things are very essential, and there are natural sources which are there That's where the seed cycling comes from. That's where we tell people to eat the pumpkin seeds, the sesame seeds, and so on and so forth. So all these things are very important. So an adequate, well-balanced diet is a must. We have to see that our patients do not have any deficiencies. Now, coming to the main causes of amenorrhea, or as a result of amenorrhea, what are the conditions in which we see amenorrhea? Basically, PCOS, then thyroid issues, stress, and a large amount of girls now are coming with primary ovarian failure. This has a lot to do with the food that they are consuming, and at times we are seeing that they are into abuse of certain substances, which is causing primary ovarian failure as well. So education of our patients is very, very important. Now, PCOS, as we all know, is a very complex kind of disorder, which many of the women are going through. So when I started my practice initially in 1993, 94, I would not see many PCOS cases, but now chunk of my practice is in rural Maharashtra, and I see at least in my practice in Nira as well, I see at least 9 or 8 girls out of 10 are coming with PCOS. So it has reached everywhere. Okay. And this has become very, very common, and it has become very complicated for us to treat, because there are a lot of things that happen to a woman who's suffering from PCOS. There is obviously irregular menses, there is abnormal hair growth, there is weight gain. Okay. And so many symptoms are there that we have to deal with. Many of them come to us at a very later stage, when they have already taken a lot of hormones, a lot of pills, and so on. So what is the most important cause of this? Many times the scientists tell us that we don't know the exact cause. Okay. But we know that many a times it is blamed to or attributed to a genetic cause. Maybe it is because her mother took a lot of contraceptive pills, so she are infused with a lot of hormones. So that is also making our balance haywire. So that is where this whole lifestyle and diet changes also comes into picture. Again, exposure to certain environmental toxins also is considered as a contributing factor. So it's right from something that we use in our house as a house cleaning agent to the cosmetics that a woman uses. All these things can be responsible for the secretion of zine hormones. So when a case of PCOS comes to us, we have to ensure that we give her a plan where we take care of all these things if we want good sustainable results. So types of PCOS, again, there is insulin resistance PCOS. There is adrenal PCOS, where because of the increase in stress, the cortisol is increased. There is more insulin resistance. There is pill induced, where the woman or the girl has taken a lot of oral contraceptives, because of which she lands into PCOS. And there are causes like hypothyroidism, which is again becoming very, very common. Are you able to follow? Am I going too fast, or it's okay?
Absolutely fine, doctor. Please go.
Yes,
Perfect.
doctor, it's okay.
Okay, thanks. So, a little bit about insulin resistance and why this happens and why we should know about it. We should know about these things, because that is how we can plan our treatment. We should know whether the case in front of us is having insulin resistance, or there is high level of testosterone in her, or what is the exact problem, or what is going on inside the girl who is in front of us. So insulin resistance happens when the body cells become resistant to insulin. So more and more insulin is required for proper glucose metabolism. And when there is more insulin required, it also signals the ovaries to secrete more testosterone. Now, when more testosterone is secreted, on the other hand, this inhibits the SHBG production, and this leads to increased testosterone levels in the blood. So here, in these kind of cases, we see a lot of male pattern baldness, we see a lot of facial hair. So these are the girls or women who are having a lot of testosterone in their blood. Now, excessive of insulin in the bloodstream also signals the ovaries to release more estrogen, and that suppresses the ovulation. So then these are the cases when we see them, they do not ovulate. Unovulatory cycles is something that they come to us with. And there is something known as low grade inflammation as well. So whenever we get infected with bacteria or viruses, etc., the natural response of our body is to secrete certain substances to fight the infection. The first line of defense is inflammation. Inflammation is something with which the healing process begins. But there are certain things which can trigger low grade inflammation. And if low grade inflammation remains in your body for a long time, then you are going to have insulin resistance, you are going to have atherosclerosis, you are going to have PCOS and many other problems. So low grade inflammation can be triggered off by certain foods also. So that is where we talk about stopping the refined sugar, stopping processed food totally, stopping gluten in some cases, bakery products, and so on. Okay, so when a woman comes to me or when a patient comes to me, in fact, at Prana, we have designed a particular program where we include homeopathy, we include nutrition, we include yoga, acupuncture, osteopathy, all these things together, because all these sciences believe in the energy of a person. So we believe in realigning the energy. By realigning the energy with different means, we are going to bring her back on track. That's the whole idea. Okay. So these are the signs and symptoms of PCOS. We know that irregular menses and absent periods and unovulatory cycles and so on and so forth. And these are the consequences. We can have infertility, we can have menstrual irregularities, possible risk of endometrial and breast cancer due to unopposed high So the investigations I'll not go into, because you know what kind of investigations we do. But the most important fact is that when a patient comes to us, she may come in a combination of unovulatory cycles or insulin resistance or endometrial hyperplasia. So we need to know what is the exact problem that the patient has, and she may come with a combination of these. When she comes with a combination of these, it is much more difficult to treat her. On a regular basis, these women already have gone to the allopathic doctors who have prescribed them oral contraceptives and metformin and metformin and things like that. So that also needs to be taken care of. And what we need to educate our patients is that it takes at least 6 to 12 months of consistent lifestyle and diet changes along with natural therapies to bring back the real changes in our body when you are experiencing PCOS. So we have to tell them that only popping pills is not the answer. You know, many times that is the idea with which they come. Okay, I've tried this, I've tried that. Now, abhi ho gaya doctor, abhi aap homeopathy de do. So it doesn't happen that way, especially when it is concerned with PCOS. So the overall idea is to balance the sugar levels, maintain the hormones, promote healthy digestion, improve the estrogen metabolism, improve ovulation. All these things are very, very important. One very important thing that we know, and why I'm bringing up this particular slide, is that we consider a lot of emotional issues in homeopathy, right? So there is enough study on this matter, and something called as a biological conflict is an idea which we know about, where when we go through, or when any person or any woman goes through a sudden incident in her life, she can land up into a shock kind of a syndrome, which then corresponds to certain emotional issues in her, and that is what is called as a biological conflict. So if this biological conflict is kept alive or is kept on, then obviously this woman is going to take time to heal. and what are the common biological conflicts that we see in women, especially in young age. We see a loss conflict. There are so many cases which will come to you where you can actually trace back the trigger of the PCOS to some loss in their family, maybe loss of a parent, maybe loss of a loved one, maybe loss of a pet also. This also holds true. This can trigger off this biological conflict in them, because eventually most of them start feeling that they are the ones who are to blame for this loss or for this break of relationship. So many of them come to us with disappointment of love in their early life, and that is when they feel betrayed, their partner has been unfaithful. These kind of conflicts are very, very common, and these are the basis of PCOS. There is a whole research on this. So we see where our remedies can actually help, because we have remedies that can cover these kind of aspects. Okay. So then when we are talking about holistic healing, we also talk and try and find out where, in which chakra, or there are 7 chakras. I'm sure you know about them. So all these chakras or energy centers, they have a certain energy, and the Swadhisthana chakra, or the creative or the sexual chakra, is the chakra related to reproduction and proper function of menstruation, so on and so forth. And this is the chakra which also resembles the feminine energy or the lunar energy, so as to say. So we see that there is a lot of disturbance in this reproductive chakra in cases of PCOS, and that also needs to be handled. Okay. Now, how to handle that is to try and see what the main issue that we are seeing in cases of PCOS is, that most of the girls, young girls or women, are trying to do what men are supposed to do. I by no means I am saying that they should not work or whatever, but the very feminine nature of their energy is to take care of children, take care of the family, love, care, nourishment, and so on. But we have now taken these things do have an impact on the overall physiology. So when we try to tell them to balance the chakra, or to get back into balance, one thing that we should tell them is to try and do more feminine activities. Try and indulge in activities which they love. Try and indulge in activities which are like taking care of children, or playing with children, or becoming a child themselves, so that these activities promote a lot of creative energy, and that will help a long way in creating a balance in them. One more thing that I always advise to all my cases with PCOS is left nostril breathing, because this connects with your lunar energy, and it is very easy. Just sit and you can cover your right nostril with 2 fingers and take a deep inhalation and exhale through the left nostril, and do this for 8 to 10 times. Ask them to do it at least 2 to 3 times a day. That will help them to connect with their feminine and lunar energy. Yoga, of course, as I said, I'm privileged to have a yoga teacher at my center and so on, but these are the 2 or 3 yoga poses which we do recommend: Baddha Konasana and Bhujangasana. And of course, we have a supervised class there, so that helps them to achieve the exact alignment and so on. One more thing is that I do is the use of adaptogens. Now, what are adaptogens? Adaptogens are substances that are naturally occurring. So they are the plants and things around us which act as adaptogens, and which reduce the oxidative stress. So these plants help us to normalize the function of the endocrine system. Most of them are used in Ayurveda. Many of them are available as homeopathic remedies as well. So many times when we give these people a constitutional remedy, I may give a support of an adaptogen depending on the cases in front, because they do need it. They come in a very bad state to us. It's very rare to see that a woman is diagnosed with PCOS and she comes immediately for homeopathy. With a little bit of awareness now, it has started happening, but most of them come to us when a lot of stress is already present in their lives. So the frequently ones used are, of course, ashwagandha, which supports the overall endocrine system. This is available in homeopathy as well. I generally use it in the form of mother tincture uh, to be given along with the constitutional homeopathic remedy that the patient is taking. Then there is cinnamon. Cinnamon or dalchini. This is something which is known to help in cases who have insulin resistance and to balance blood sugar. So the cinnamon tea is something, or decoction is something which you should always promote. It also helps in menstrual bleeding. So many times menstrual bleeding because of endometrial hyperplasia, you can give them ask them to take cinnamon tea that will quieten down the bleeding. Gymnema is something which also I use when I see that there is a lot of insulin resistance, because this helps in to curb the sugar cravings. Licorice root or Glycyrrhizia glabra. This is something which is very important, because most of these cases, what happens is nowadays, if you see an ultrasound done of a so-called healthy looking person, also there is grade 1 fatty liver or things like that. There is non-alcoholic fatty liver. So all the toxins and all the substances that we are consuming are actually ultimately being cleaned by the liver. So the liver is having a lot of load, a lot of toxic load to, clear. And this licorice root is something which helps in detoxing the liver. So it is a very, very good substance to give when you see that there is grade 1 fatty liver or something like that along with your PCOS. Maca is something which the root maca, again, this is available in homeopathy. It is known to balance the estrogen and progesterone, and it is known to produce a healthy or promote a healthy menstrual cycle. Agnus castus, this is one remedy which we have studied in unovulatory cycles. So when you suspect that there are unovulatory cycles, this is one medicine or remedy that you can give along with your constitutional. Now, peonia is also something which I have used actually in the past for piles, piles or hemorrhoids. But it also is a very good muscle relaxant, and it helps in reducing pain during menses, and it also helps in lowering the hormonal toxicity that is there. Semicifuga is again something that we know, but the specific action of semicifuga is to reduce the LH hormonal level, which is too high many a times. Milk thistle again is a key herb for liver toxicity. It protects your liver cells against the cellular damage. So all these adaptogens are very, very important when we are treating a case of PCOS. Again, I was talking about certain elements which are necessary. Chromium is something which is very, very necessary, because a deficiency of chromium can cause insulin resistance. So are certain vitamins. Most of them are useful for controlling the weight, for helping to turn the fat into sugar and protein into energy, for better glucose tolerance, for production of thyroid hormones. So all these B1, B6, B12 are very, very essential. And a lot of the patients which come to us are deficient in B12, B1, B6, and D. Okay, so a correction at that level is also required. Zinc again is something which is very important as an element, because it helps in controlling the appetite, and it also is necessary for a lot of hormone production, and it is extremely useful in balancing the sugar. Now, magnesium, there is a very strong link between magnesium deficiency and insulin resistance. So a lot of women who have magnesium deficiency, they will complain of cramps and things like that. If you start giving them magnesium, maybe magnesium sulf 3x along with your homeopathic remedy, surely the cramps will reduce and they will have better response to insulin. Vitamin D, as I told you, low levels are, it is really rampant. Out of 10 out of 10 cases I see have low vitamin D. Very rarely I see that there is adequate amount of vitamin D. And vitamin D is necessary for a lot of processes in our body. It is actually said that it's not a vitamin, it's a kind of an hormone. And it is very important when it comes to insulin resistance in PCOS. Omega 3, of course, is known to reduce the testosterone levels. So, omega 3 fatty acids are also very important. Now, coming to the remedy and coming to few cases. Common remedies we know are, of course, pulsatilla is the first remedy that we think of. But many a times we miss out on pulsatilla in elderly women, especially those women who are having problems at full moon. Now, this full moon, new moon aggravations and all that are something which is very, very unique to homeopathy. And believe me, patients have it. You know, there is no other science which talks about a new moon aggravation or a full moon aggravation. Okay. We also know about the desire for cheese and highly seasoned food and all that. But the main thing is we miss it out in elderly women. We tend to give it only in younger women. Then cyclamin is one remedy which is also very, very useful in PCOS, where the patient is chilly and she feels better in open air. Rustox and aconite, again, very important remedies for amenorrhea from feet getting wet. And we have to remember of sulfur when pulsatilla is indicated, but it fails to give results. Natrum mure. Natrum mure is the most used remedy for infertility and PCOS because obviously of the emotional aspects of natrum mure, where we have ailments from disappointed love and so on. But it is very sensitive to music, but it is very important to know that what to do if natrum mure is indicated but it fails. Then you think of kali carb as a remedy, especially in one remedy that is going to help you. Apis mellifica. This is one remedy which we use very often, especially when we have edema, and the patient is awkward. So a lot of these patients with hormonal imbalance, PCOS and all, have a lot of edema on their feet or a lot of edema on their face as well. They talk about water retention and so on. So when you have this kind of a patient, you should think of apis mel as well. Gossipium. I don't know how many of you have used this Gossipium, but there is a rubric in the repertory which says that which is very, very indicative of Gossipium. There are patients who will say that I have this sensation, doctor, that the flow is about to start, but the flow doesn't start. Can anybody tell me the remedy? Just the rubric, sorry. Okay. So in the repertory, it is known as Mollimen. Okay, you will find this symptom expressed under the rubric Mollimen, where the sensation is there that everything is there. The menses are about to start, but they don't start. Now, in such cases, Gossipium is an indicated remedy. It is one of the main remedies for this kind of sensation. It can be given to induce menses when especially this keynote is available. Another type of cases which come to us where they say that they only have backache, but they don't have menses. They have all the symptoms, and when the menses are to appear, they have backache. In this case, and when there is overuse of contraceptive pills also, or maybe use of emergency contraceptive in some cases, the two remedies that you should think of is Senecio and Thuja. Okay. So functional amenorrhea in young girls with backache. Backache is classical in this remedy. They will complain of only backache and no menses. Okay. So Senecio is a good remedy. I have given this to many cases when they have this indication, and just giving Senecio 30 BD for 4 to 5 days can initiate their periods and regularize their cycles. Pinus lambartiana. I don't know whether you have heard of this remedy, but this is a specific remedy for amenorrhea, and it is empirically given in mother tincture form to try and induce menses. Of course, it causes abortion in pregnant women, but this is something which we have used empirically. Like many a times the allopaths would give progesterone, increase the dose of progesterone, or maybe give progesterone for 5 days and then suddenly withdraw it and to produce menses. But in most of those cases, this remedy in mother tincture form will also help you. Okay, coming to the first case, this is a case of a 14-year-old girl. As I told you, I'm going to share remedies which probably we generally don't think of in amenorrhea or things like that, because then that is what we learn from. Okay. Is it fine? All going well?
Yes,
Yes,
doctor. Perfect.
Say yes.
Yes.
Yeah.
yes, doctor.
Okay. So, yeah. So, a detailed history was taken. This girl came with irregular periods. The periods had just started a year back. So, that was something which even the mother thought that, okay, चलता है अभी थोड़ा 1 साल ही हुआ है वो regularize हो जाएगा वगैरह. But turned out that she actually had gastric issues since the age of 4. So how did we find out? The whole story was that at the age of 3, she was given some vaccine or something, after which, she started looking pale. Her grandfather found out that this girl is looking pale. So let's go and do a test. And they did a CBC and low hemoglobin was found. It was 5.9, ferritin was low and all that. So she was admitted to the hospital. She was given supplements and all that, and she was a bit okay. But each time after a few days, the iron levels would go down, and again, she would require some medication for that problem. So this went on. So finally, they went. She had got celiac disease. Okay. So from the age of around 8 or 9, she was put on a gluten-free diet and put on, they would give her iron infusions and so on. So when she came to me, she was around 14 years old with all this history in the background. And we see that she has menstrual issues. She has issues of absorption, iron absorption, gastric issues were still there. And she had this diagnosis as well. So as I told you, there was some history of vaccine given and all that, but I was more interested in the person as a whole because I knew that she already has celiac disease, and there is a sort of a picture that I see in front. So I want to try and understand this. So her grandfather and her mother and all, we sat and then we discussed. And they said that she has a lot of stranger anxiety. Now, of course, you can imagine that this is a 13, 14-year-old, so she's a teenager and she had her own strong opinions and all that. But through this, we got this whole history. The mother had a troubled pregnancy, and she had also given this information to the previous homeopath and all that. She had gone through a rough patch in her marriage after when she was pregnant with this girl, and all this history was there. But more peculiar about the patient was that she was very sensitive to music. She was very, very sensitive to loud noise. And she was very restless. She could not sit in one place, constantly moving around, doing things, this, that, whatever, not contented with anything. The food that was given to her, she would, demand for something, refuse it. And typical whole this thing was going on. She also would have nausea. She would say that stop playing that music, I'm feeling nauseous. Okay. And she desired oranges and banana and bread. With this, I'm sure that you all know what the remedy is. Okay. The remedy, of course, we did a repertorization, and the remedy that came up was, of course, Theridion. Okay. Now we said, wow, fantastic. We have found a remedy which is going to help her. So we give her Theridion. and we gave her Theridion 1 mg, 1 dose, placebo, and so on. And what happened? We did follow-ups every month for 8 months. Okay. And there was some improvement in some of the symptoms. Okay. Like the sensitivity was a bit better, the fear was not there, the restlessness was a bit better, etc. But the abdominal symptoms like diarrhea, bloating, cramps, nausea, and all these, the menstrual cycle issues, they were not improving at all. So in these 8 months, we didn't move anywhere as far as those areas were concerned. So I thought, now what is the main thing that she's having? She was obviously intolerant to gluten. Okay. So, with the history of allergy to gluten, with the history of sensitivity to certain foods, etc., I gave her a remedy, Triticum vulgare. Are you aware of this remedy, Triticum vulgare? Yes, no? Okay, I take it as a no. I think everyone is awake or sleeping.
Doctor, we are all awake.
Okay, fine. So,
The answer from the
Triticum.
doctors is no, we've not heard of this remedy.
Okay. No, because see, generally we are used to interacting with audience who's sitting in front of us, no? So, yeah. So, anyway, so Triticum vulgare was the remedy which I gave her, and 1 dose every 15 days was given. Now, what happened after that? 4 months after this exercise of giving her Triticum vulgare in that manner, we have her saying that her bloating has reduced significantly. She had diarrhea only once during those 4 months. No ulcers in the mouth. That was another classical feature that she had. She would get ulcers in the mouth, which is something common in celiacs as well. The energy levels are better. The periods are regular. Okay. So on May 2022, we see that she's much better. She's getting regular periods, no episodes of diarrhea since December. The bloating is not there. She can tolerate many foods now. She doesn't react to bread. Now she's eating. Of course, I had given her a biochemic remedy for her hemoglobin also, okay, along with the Triticum vulgare. But this was the result. So then what we advised is to repeat her test, which was originally positive, and she's still under follow-up, but she's significantly better. The periods are better, the bloating, the gastric symptoms, everything is much, much better now. Okay. So this is one case where an unusual remedy helped her. Now, again, I saw another case at similar time. I saw this case. This was a 16-year-old basketball, district level basketball player who already had this celiac disease diagnosis. Menses erratic, same story, taken Ayurvedic, etc., etc. But now this girl was, she was not really bothered about her menses. She said, कि ठीक है ना, नहीं आता है टाइम पे, इतना कुछ मुझे ये नहीं है वगैरह. So we go on. So we find that the first menarche she had at 13, first 2 years it was fine, then it became irregular. She felt it was because of overexertion, because she was doing basketball training, and then she would have pain whenever she would get periods. She would have pain in the lower abdomen. It was better by hot packs. First it was coming twice in a month, then it started coming every 35 days, and we saw that her iron levels were also low, so we put her on supplements and all that. This is what the mother is also saying. So she says, I don't get affected by all this emotional stuff. I don't take things seriously. I'm a very quiet person. uh, Mother says she's very loving and caring, but she doesn't share things with us. She gets angry very easily. She's very headstrong. She always wants to contradict her parents, wants to do everything opposite to what her parents tell her. Okay, very, very typical in teenage. But and then she says that they keep forcing me to do things and I don't want to do them. That makes me angry. So this is a girl who feels that she's being forced to do things against her wishes. Okay. She says that I'm mature enough. I understand what is right, what is wrong for me. Why do they have to tell me? Okay. I feel at times I feel guilty because they keep on telling me what I'm doing is not right and so on. So with this whole story, I actually gave her a remedy, Ferrum Med. Now, if you read the Materia Medica of Ferrum Med and the recent provings of Ferrum Med, you'll find how this story matches. These are the ones, typically teenagers in an Indian family, who feel that they are being forced to do things against their wishes. And of course, she had this iron deficiency and so on. So we gave her Ferrum Phos and Macphos also for period pain. Then she did not get her periods after that. Okay, it's still the same. So what I did was, in this case, I used the remedy progesterone to induce her periods. Now, progesterone 12C was given for 5 days because I could not think of anything else in her case at that point of time. And I felt that she will just drop out if now she doesn't get periods. And she's come with a lot of faith that I will be able to help her. And we continued with Ferrum Phos 3X. So in February 2020, she says that she got her periods after taking the 5 days. Obviously, the progesterone had helped her and took pain SOS. And then she just disappeared after that. Then she comes to me in October 2021. So there's more than 1 year gap. So I've been asking her, what happened? For 1 year, you've not reported. So she said, no, the periods became irregular after that. So I did not think that it is required, and pain also was there sometimes and all that, but she could manage that. But now she connected with me because she was going out abroad somewhere for her education. So she would be eating outside food and all that, and that is why they are consulting me again. Okay, that is when the mother tells us that she is allergic to gluten, to dairy, to many foods. They cause a lot of rash and itching on the body. I have to take antihistaminics. They cause puffiness. Then frequent eruptions on the skin, acne, pain in the abdomen during menses. So again, with my previous experience, I knew that this girl is again gluten intolerant and she will do well with Triticum vulgare. Triticum vulgare is a remedy prepared from wheat. Okay. So this remedy was given to her, 1 dose every month, Macphos again for her pain, and placebo, TDS, and of course Ferrum Phos for the anemia part. Then in Jan 2022, her periods are regular. She says periods are regular since October 21. There is no pain during period, no puffiness, no breathing issues. I have started introducing dairy and gluten now. Though I'm not consuming it a lot, but I don't have any reaction like before. There is no urticaria. So we just continue placebo. Then in July 2022, she is not reacting to food. Only if I eat pizza from outside, I feel bloated. So her energy levels improved, overall sleep improved, the periods became regular. Okay. And then in August 2022, she was much better. She has introduced gluten and dairy back, but she doesn't have any issues of those sort, though she's very careful while eating outside. Then she went on a family trip. That's the time where I just came back on my own and there was no anxiety, no panic. Otherwise, I would have panicked and so on. So the periods have become regular and she's doing absolutely well. She is gone abroad for her studies and she's doing absolutely well. So these two cases were something which told me a lot about gluten and gluten allergy, and how probably apart from managing periods and PCOS and all that, even we can manage celiac disease very effectively as well, probably with these remedies at our hand. Okay. The next case I will talk about, again, a young girl The main issue of this girl was that she had acne, excessive hair. So the testosterone levels were high, and she already had PCOS, menarche when she was 11 years old, and then it started getting delayed. Now her aunt had similar issues. The aunt had taken some contraceptive pills, etc. So this girl and her mother started feeling कि इसको भी ऐसे ही हो रहा है सब. So they wanted to consult, and so she also was put off gluten, because they heard that gluten and milk and these things can worsen the PCOS. So they put her off gluten. They were trying to understand what is going on wrong with her, because she was just gaining weight and she was getting a lot of facial hair as well. So for the facial hair, they tried to do her laser treatment, but the acne flared up, so they had to stop that. Then I think couple of months she had taken isotretinoin and things like that. But then I asked her about the whole story and her history. Okay, so she had this problems in grade 5 when there were a lot of issues that she had. Uh, then there actually the whole story was that her parents were already quarreling a lot. So there was a lot of this quarrel going on in the family, and she felt that she should just vanish from the planet Earth. She also had some suicidal thoughts and so on, and that is when her periods also started getting irregular. Okay, now and she would overthink. She just wanted to disappear. She didn't want to deal with this. In general, the focus was that she keeps on thinking about negative things, worse things always. She The core belief that she had, that people were cheating her, people were betraying her. Then I tried to understand where this whole thing came from. Then she said, doc, I'll tell you, my family is very abnormal. See, I'm trying to um, concise this, because this case has gone for more than an hour. Okay, so I'm just trying to concise the information, because what we are interested in, what is the remedy that we gave her with all this. So she has a very bad uh, parental kind of family history. And it was as if the father was not there, and she said, it really sucks. Father is not there, he's not bothered about me. And when I see other children with happy families, then I get affected a lot. So this whole feeling of the father figure not being there, the desire for music, etc., etc., fear of ending up like her mom, who was just dependent on her father, fear of failure, fear of being betrayed, to the extent that she felt that having a relationship with any man is not worth. All this was very, very strong in her. Okay, so we see that she is very vulnerable. She lacks perseverance on one side, withdrawal. So whenever there is a situation, she will just withdraw, go back. She'll not want to face it. She feels lonely. She feels closed. She weeps alone. There are issues in her relationship, and she doesn't express anything. She just holds back. And on the other side, there are issues of self worth, dignity. She's very shy, and there are issues with her father. So these are the two things that are very, very prominent in her case. It is as if the father is totally absent. Now, when we think about this as a picture, the picture that comes to our mind is that of a remedy known as natrum carb. If you read this remedy from Jan Scholten's Materia Medica and other Materia Medicas, you will find this story of the absent father being very strong. The father figure not being there is a very, very important aspect in natrum carb. And natrum carb is made of two things, natrum and carbonicum. So it has the essence of natrum muriaticum as well as the essence of carbon, a combination of that. So I would suggest that you read this remedy for a better understanding. So she was given natrum carb. She was followed up regularly. The period started coming on time. the acne were there for some time. They came off and on. And then after some time, I felt that she would require an intercurrent remedy. So Sorinum was given to her in 1 m, just one dose. And then subsequently at this date, her cycles are regular, no pain, flow is normal. She had been to a gynac where she did an USG, and she told her that I can't see the cysts anymore. Emotionally, she's better. She's enrolled for a course in one college in London. She's referred her father and mother both for treatment. So obviously, she's doing very, very well with this remedy. So this again was a remedy which normally we don't think for PCOS. Okay, that's the reason why I presented this remedy. Going ahead,
Doctor, just
yeah.
a moment. Can you please check your connection because it seems to have been breaking in between. Like we just get it blank, the screen just freezes. So can you just check your connection?
Can you see now? Can you hear me?
Yes.
Okay.
Actually, Dr.
So
Abhay, we are able to hear you and see you, but in between for a few seconds,
Yes.
everything freezes. I was thinking it is my internet problem. Now,
no, I
Diyoshi
don't.
mentioned about it.
Yes,
Yeah.
yes,
So
Dr. Deepak. Even I was thinking that maybe it's my internet, so I was constantly, checking it if my connection
so
is secure.
good. So anyway, don't worry. If it is my internet connection, I have changed it. So don't worry.
Okay.
Now it is your internet connection.
Okay, so now we are good to go.
Okay. So again, let's now can you see the slides?
Yes, doctor.
Okay. So PMS, again, PMS is something which a lot of women come to us for. Now it's a constellation of physical, emotional disturbances. A lot of things happen during this time. So we know what the symptoms of PMS are. So let me just rush through these initial slides because I will be more interested in sharing some unique cases that we have. So there are different causes. They say that the progesterone levels are not in balance. That's the reason. They say that the endorphins levels are out of balance. Some scientists say that vitamin A, B6, E, all this is a mess. So that is the reason why there is a lot of PMS. Okay. So the symptoms are mood disorders, anxiety, nervousness, mood swings, irritability, behavioral changes, everything we can, actually blame it on to PMS. Everything. Even if a woman goes and dashes her car somewhere, she can easily blame it on to PMS, and it is covered under that. So all these kind of mood changes, all these kind of physical problems are seen. But I would like to share a case with you of a young lady who was actually having a lot of pain before the menses, and she would become irritable. And she was a music teacher by profession, and she would give piano classes to young children. And the problem was that why she came to me is that this PMS is creating a problem, doctor. 2 to 3 days before the periods, it's so much of irritability and all that. I cannot concentrate. I cannot give music lessons. The very music I love to teach, it irritates me. I don't know what to do. So here we see that she has given us some very precise information. She is a music teacher. She has PMS now. Again, PMS, the common constellation of symptoms is there. You can go and search for irritability before menses and this and that and that. But the main thing what she says is that the very music I teach irritates me. I cannot give my music lessons. Very important. So in my case, what I was trying to search is कि कुछ भी हो उसमें ये म्यूजिक का सिम्टम का ये होना चाहिए. Okay, whatever that remedy I think of. So I searched into the repertory, and I searched for irritability, music, this, that, and interestingly, there is a rubric: irritability, music, lessons cannot give. Can you imagine? And can you imagine the remedy that is there? The remedy that is there, it is only one single remedy, that is Kali Brome. So this was the first time I thought of Kali Brome, because the patient actually led me to this, because she said specifically and I was able to catch it, you know. So this remedy covers these aspects very well. It covers the irritability before menses. If you search for that rubric, it is there. It also covers the intolerance to music or irritability because of music and cannot give the lessons. Okay. So she was given Kali Brome and she did beautifully on Kali Brome. She required Kali Brome for a couple of months, few doses, 1 one dose every month for 3 months, and she was absolutely fine after that. Okay, so of course the common remedies we know, which we often use: sepia, then chamomilla, which is very hypersensitive, ugly behavior, capricious, constantly changing their behavior; lachesis, which has got jealousy, irritability, irresistible desire to run in open air, intolerance of tight clothing. So these are very common. Again, Bovista, where we have, like Epis, we have fluid retention and puffiness. Bovista is one remedy which is very, very good for allergies from artificial jewelry or makeup. You know, when you get when you get a lady who talks about the makeup causing problems or hair color causing problems, then you should think of Bovista. Folliculinum is one remedy which I use for overuse of oral contraceptives. Of course, there are various potencies of folliculinum which are used in various stages. So that is something which is for a discussion at some other point of time. Menorrhagia and metrorrhagia is another condition where we see a lot of cases where we use remedies like Sabina, where we use remedies like hemimelis, but hemimelis is specific, you know, injury due to riding on rough roads. So whenever you have a case which talks about going on maybe a two-wheeler or something where the road was rough and after that she has bleeding, especially passive flow, painless flow, then you can think of hemimelis. If the history is bleeding from overlifting, then it is mellifolium. If it is from displacement of the uterus and bleeding from fibroids, then it is trillium pendulum. Sickle core is watery discharge of blood, and that discharge continues till the next period. Thalassae bursa pastoris is again a remedy very classically used in bleeding due to fibroids and uterine inertia. Next condition we talk about is dysmenorrhea, where xanthoxylum is one remedy which I will talk about. Of course, we have a lot of remedies like colocynth, macphos, and so on and so forth. But xanthoxylum is specific for neuralgic dysmenorrhea. So if a patient comes to you who talks about excessive pain, she cannot bear the pain, electric shock like pain, she's rolling on the floor because of pain, then you should think of xanthoxylum. This is one case. Let's hope that this video runs. Okay, but anyway, she is talking in Marathi. The translation is here. So before the medicine, she would have pain in the back and the pubis, and she would not feel better in any position. So it was typically like Sabina. The pain was like shocks. And now, after taking the remedy, she says that there is no pain, the flow is also moderate, and she's much better after taking xanthoxylum. So she was given xanthoxylum for exclusively for pain management. Okay, there was no other concern that she had. Okay. Some other conditions which I will just briefly touch. One is cervicitis, which I see very commonly in my practice. So thuja is the remedy if there is history of suppressed infections, sexual infections. Sulfuric acid is the remedy if it is from or due to surgical operations, and nitric acid is ulcers on the cervix, multiple ulcers on the cervix. Now, let's come to menopause, which is again a condition where a lot of cases will come. Again, this is the time when you will have DUB, they may come with fibroids, and they may come with a lot of problems, psychological problems as well.
Dr.
So it's a
Abhay,
process.
just 1 minute. I will just
Yeah.
announce because I think everybody is typing their messages regarding their questions. So all questions will be answered in the end. So whosoever has any questions, please type in the chat box. We will take up all the questions towards the end only. Thank you. Please, you can continue.
Yeah, so I will just rush through because I think we just have 15 minutes now. So I will just rush through this slide, these slides, because there is a video case which I want to show. So there are some short-term symptoms, some long-term symptoms of menopause that we have, wherein we talk about osteoporosis and increased cardiovascular risk and so on and so forth. So many a times it's a question whether to treat, whether to not treat, what to give. Modern medicine obviously gives hormone replacement therapy. Homeopathy obviously considers it in a holistic manner. And there has been a lot of discussion about HRT and which hormones to give, which hormones help, and so on and so forth. Risk of HRT and all that is there. But we have a natural alternative in terms of homeopathy, nutrition, yoga, and exercise, which really helps. Again, the common remedies most of you know about. The symptoms of these remedies we know typically. So I'll share these slides with you if you want the text of the slides. Then amylum nitrosus is one remedy which is very, very peculiar because it has flushes of heat, it has anxiety and palpitation, and typically throbbing carotids. So when these kind of symptoms are present, you can think of this remedy. Murex, again, increased sexual desire and must sit cross-legged. Conayam, we know, ailments from non-gratification of sexual instincts in old maids. Okay, this case of a 47-year-old lady came with hot flushes. She's accompanied by her daughter-in-law. The lady did not give much details, but the fact that the problem was getting aggravated, and she would get aggravated each time she woke up in the morning. So typically aggravation from waking up, and she could not tolerate tight clothes. So obviously the first thought was lachesis. Okay, so we gave her lachesis. Okay, now after giving lachesis, what happened? It did not give results, did not help her. So she came again. So I asked the daughter-in-law again, tell me, what is it? She's not giving much history. Tell me, what is it about? So she says, doctor, she's actually a very talkative patient. She constantly talks and talks when at home. I don't know why she's not doing it here. But the one peculiar feature is that she constantly says that there are too many things in the room. Why have you kept so many things in the room? I had kept 4 chairs. Now, why are there 5 chairs in the room? So she had this habit of constantly counting things. This was very peculiar again for me because before this I had never heard this. Okay. So she says, see, I had put 10 flower pots, now there are 7. What happened? This, that. So this was the story that the daughter-in-law gave. Very important observation, which I learned later. Because when we put counting in the repertory, now I decided, let's see, this is very, seems to be very peculiar. I have never heard anybody tell me this. And lachesis has not helped. So I put counting. Okay. And when I put counting, these were the remedies that come. Okay. Out of that, one remedy that came was physostigma, which was also there originally in my repertorial chart. But I was very prejudiced about lachesis, so I had given her lachesis. So I went further and tried to read about physostigma. Now there is this one rubric, counting continually things in the room, and the only remedy was physostigma. Okay, so I decided, okay, let's see, let's give her this remedy. And here is the remedy. It was there already, which I had not taken into consideration at that time. And I had just taken this loquacity and hot flushes and forgetfulness and things like that. So, physostigma, if you read from the Materia Medica also, you will see this whole description given in the Fatak's Materia Medica. And this lady did very well on physostigma. Now, this is one case which I would like to share. It's a video case. Please bear at least here first 2-3 minutes, then I'll tell you what the whole story is, because we are running out of time.
और फिर 1.5-2 घंटे का कुछ सुस्ता नहीं, मतलब बैठ जाना पड़ता कुर्सी पे, ये हाथ इन्होंने भंगल के ऐसा इधर चालू की ना, ये हाथ भंगल की जोड़े, तो फिर इधर.
So she is typically at the time of menopause, and these are the symptoms that she's experiencing. She's experiencing hot flushes. She says that I have to run to the toilet very frequently, और ये हाथ में बांध डालती हूँ वगैरह, ऐसा सब उसका नरेशन.
तो फिर थोड़ा बैठ जाए, तो पूरा दिन है ना मेरे को ऐसे ही जा,
ये देखो मेरे हाथ कांप रहे हैं,
ऐसे कांपते हैं, दिन भर कांपते हैं. और समझो ऐसा कुछ काम भी सवेरे में तो बहुत तकलीफ होती है, जब 5:30 बजे उठती ना,
अर्ली मॉर्निंग एग्रीवेशन
चालू हो जाता तो 12 बजे शरीर की टॉयलेट जाती आती
सुबह 7 बजे से 12 बजे तक पेट
नींद खुली ना मेरी, जब से पेट दिखना चालू हुआ, और दिमाग में नस्ती गड़गड़ चालू हुई, कोई भी बात नहीं.
I hope all of you are able to follow her.
और मतलब ऐसा
दिमाग में घन and all that. Typical narration.
पैसों का टेंशन,
पैसे का टेंशन, बच्चों का टेंशन, अपन इतने एजुकेटेड नहीं है उसका टेंशन है. ओके, मैं हमेशा बुराई सोचती हूँ. सो आई वांटेड टू अंडरस्टैंड वेयर इज ऑल दिस कमिंग फ्रॉम. सो आई आस्क हर कि क्या बोलो ना जरा ये डिटेल में सब. तो
ये बच्चे का एक्सीडेंट हो गया, वो फिर हमारे घर वाले मतलब ऐसा नहीं कर, दूसरे औरत से वगैरह से बातचीत करते, सर रिलेशन रखते, मतलब वो बोलो नहीं.
So she is, skeptical कि मैं बोलूं कि नहीं बोलूं. तो आई अश्योर्ड हर कि देखो आप बोलो, बिल्कुल किसी को भी मालूम नहीं पड़ेगा, बट आप बोलो जो भी है वो. एंड देन शी टेल्स अ होल स्टोरी वेयर we don't have time enough, but she tells the whole story of how her husband is having an extramarital affair with another woman who is much more good looking, educated, and he has an affair with her, and he flaunts around with her. He takes her outside, he takes her to parties and all that. And she says that I expect him कि बाबा तुमको करना है ना करो, लेकिन बाहर जाके आप ऐसा मत करो ना, उसको घर में लाके रखो, इधर रखो वगैरह वगैरह, ऐसा ही करो. और बाहर दोस्तों के साथ वो लेके जाते हैं, उनके साथ वो सब ऐसा ये करते हैं कि यही मेरी असली बीवी है वगैरह, ऐसा सब ट्रीटमेंट इसको मिल रहा है. ओके, सो दिस स्टोरी गोज ऑन, इट गोज ऑन फॉर एंड मोर देन an hour. Okay, so we'll just try to get glimpses.
क्या पता, वो भागने से मेरे को ऐसा लगता है कि मेरे को रिलैक्स लग रहा, तो फिर वो 5-5:30 तक बैठ जाती थी, 3 बजे से तो 5 बजे वापस काम मेरा चालू हो जाता. मैं बहुत खुश रहने की कितने भी मतलब टेंशन रहो, अब इतना बच्चे का एक्सीडेंट हुआ ही हुआ, और मैंने कभी किसी ने बताई कि मुझे इतना टेंशन है. मैं अच्छा ही सोचती, मतलब कोई चीज ऐसी बुरा बोलते ही नहीं करने के, ऐसा होगा वैसा होगा, कुछ बुरा.
Okay, so we'll just cut this a bit short. So this is her story, where her husband is not treating her properly. He's already having an extramarital affair, and because of which she has got palpitation, she's got anxiety, pain in abdomen, there are palpitations and all that. All this is happening since 9 years. So typically, to understand chronic cases and things like that, I use something called as the W approach. Ask why, what. Okay, and then you get answers. When you get answer to the first why, then you ask the next why, kind of. So this is a technique that I follow. But here, what we see is the sensation at a physical level. She's experiencing palpitations, frequency of stools, pain in abdomen. She feels tortured by everyone, mother-in-law, sister-in-law, brother-in-law. All this she has narrated in her history. She feels used by her husband. She cannot do anything about it because she's less educated. Okay. The other woman is beautiful, more educated, more fashionable. She feels that she'll be made fun of. She'll be looked down upon. She cannot go out, earn for herself and her children. And also, if she does that, she will lose the stake in the property. So that is why she's not going out and suffering through all this, you know. And the only choice that she has, or she says that the only choice I have is to please my husband because he is in control, he is the master. I have to please the master. That's it. Any thoughts on the remedy?
Lag group.
Perfect. So lack, and she was given. So with the loquacity, speed at which she talks, jumping from one subject to another, obviously we are sure that this is from the animal kingdom. वो मुझसे सिर्फ मेरा सिर्फ वापर करता है, यूज करता है, मुझे नीचा दिखाते हैं, मेरा कुछ वैल्यू नहीं है, कुत्ते जैसा लाइफ है. दिस इज द सेंटेंस दैट शी यूजेस एट वन पॉइंट इन हर नरेशन. मेरी अवस्था जो है वो एक कुत्ते जैसी है, उसको है ना बांध के रखो, उसको खाना फेंको ऐसा तो वो खाता है, नहीं फेंका तो वो नहीं खाता है, ऐसी मेरी अवस्था है. So with your case taking, if you really can go, you can go to this level, to the source level. Okay. So we went, so the remedy differentiation and all that needs, what are her main features? She needs to belong to a group and she has to pay the price for it. She needs to be in that family, and for that she needs to just be treated like whatever they are treating her. She has very low self-esteem. The other one is good looking and she is ugly. So good versus bad, ugly versus beautiful. Loquacity is there. So all this points to typically animal kingdom and mammals. Then delusion, despise, delusion, looked down upon, thinks himself of little consequence, anxiety felt in the heart, anxiety and palpitations in the heart. And all these rubrics point to the remedy, lack can. So here is the follow-up.
कुछ नहीं, धड़ बढ़ना, ये सब कुछ नहीं.
Where is the video?
Anyway,
the video, you can listen to the audio.
पहले क्या होता था, घड़ी घड़ी आपको मतलब थोड़ा सा कुछ हुआ क्या, टॉयलेट को भागने बदल तो हो जाए, उल्टे हो जाए, अभी वैसा कुछ नहीं होता, ऐसा कुछ नहीं, वो भी नहीं होता. और नॉर्मल ये समझे 1 महीने से थरका, उससे पहले दवाई करती थी ना, तो थरका भी बंद था, ये भी नॉर्मल था. जो सोते टाइम जो तकलीफ होती थी ना, 1.5, 2, 4 घंटे, अब ऐसा कुछ इसमें लग रही. अच्छा, दोपहर में भी नहीं लगती, शाम में भी नहीं लगती, भूख भी नहीं लगती, जो पहले लगती थी ना, अभी मतलब नाश्ता करने के लिए भी खाना ऐसा कुछ नहीं. मतलब बाकी वजन भी कम होगा सर, उसके लिए भी दवा अच्छा
है. Okay. So there is a comment which she makes in her follow-up also that वो मेरी पूरी 9 साल की जिंदगी है ना, वो आपने बदल दी डॉक्टर, इसलिए मैं आपके पास सब एक पेशेंट लेके आती हूँ. So this is the way in which we can, change somebody's life through homeopathy. So she was given Laccan 1M1 dose, and because of her condition, I had given her LM potency also. Okay, now there is this case of a posterior wall fibroid, but I would just want to probably skip it because I think we are running short of time and I have not even touched infertility.
Sorry,
I
doctor,
think
but we do have half an hour.
you have half an hour.
Yes, we do have. It was 2 to 4. It's just 3:30 here right now. So we still do have half an hour.
Or maybe
Okay.
we can continue for another 10 minutes, 10, 15 minutes, because we want to leave some questions, time for
Yeah.
questions as well. So
Yes.
maybe another 15 minutes would be good.
Yes.
Okay, so then I will just skip to the fertility part because it is more interesting. And one thing I would also like to tell you, there was in the introduction, Devashri spoke about my experience with obstetric cases where I manage pain during labor and dilatation and all that. And I always have to defend this idea because everyone whom I talk to about this, they say कि अरे हम नहीं देखते ऐसे सब cases. हमारे पास डिलीवरी का केस नहीं आता है. Okay, so but I think this is a very unique opportunity. I would love to share it someday, maybe some other presentation. But why I want to share it is because all these kind of cases that we are seeing right now, it's okay. You know, you can go wrong, you can fail, and doesn't matter much. But when a woman is in labor and you give her a dose of maybe chamomilla because she is being very uncivil, or some remedy like belladonna which helps her with the dilatation or her hypertension, it's a different feeling altogether. So just for knowledge sharing, maybe some other time we can do that presentation, because you can at least use these remedies in your own family practice, or when you have friends who are in labor, or somebody in the family who is going through that. Okay, so anyway, we'll come to that presentation later. But this case was of a posterior wall fibroid, which got resolved by the remedy Sabina. We have a video follow-up. We have a report which says that the fibroid has disappeared. And this is the follow-up.
नॉर्मल जाण्याचं जे पूर्वी तक्रार होती ती आणि आता त्याच्यामध्ये काही फरक वाटतो काय फरक
कमी जातं आणि गाठी जे जाणवल्या त्या एकदम कमी जातात. 4 दिवस जातो पण कमीच आहे. पूर्वी 4-5 दिवस जास्त नाही.
आणखी काय त्रास व्हायचा पूर्वी आईच्या वेळेला
दिवस आधीच वाढली यायची. आणि अंगावर जास्त
आता नियमित येते पाळी.
Okay, so quickly moving on to infertility. Again, primary, secondary, common remedies used are natrum muriaticum, sepia, iodum, folliculinum. Okay, and there are specific indications for this. But certain remedies, I'm sure you're not heard about. Tribulus. This is a remedy which is used in Ayurveda also. It is known to regulate ovulation. Lipidus is one remedy again which we use, which increases the progesterone levels and stimulates the endocrine system. So I have been now involved in a lot of infertility cases and cases which are IVF failures and all that. So there we need to really again put them on a proper diet, detox them at times. We have to also at times just give homeopathy as a supportive. So these are the remedies that I generally use there. Okay. So again, we have certain key features about certain homeopathic remedies. Natrum mur again is one remedy which we use very extensively, but it is indicated in diminished sexual desire and aversion to coition and dryness in the vagina. Then natrum carb is specific for non-retention of sperm. Sepia again, vaginismus, must sit cross-legged. Aurum mur natronatum is another remedy which we use very frequently when there is induration of cervix and ovaries and enlargement of uterus and hypertension. Bovista again is a remedy. Alitris is one remedy where there is leukorrhea with sterility, and there is uterine atony. Ebil moschus, again vaginismus. Iodine is good when there is hypothyroidism, PCOD, and infertility. These are just few lines which I am telling you. Aristolochia clematis. Now, this is a remedy which is a combination of pulsatilla, and so the sensitivity of pulsatilla, the domination of sepia, and the history of injury of arnica. When this kind of a combination exists in a patient, and if she is somebody who's received a lot of oral contraceptives and a lot of medicines, then you can think of this remedy in infertility. You can also think of it in PCOS and other human conditions. Okay. Epis we told about. Sencris. This is an interesting remedy. We have a lot of cases where if there is a history of sexual abuse, okay, sexual malhandling and dreams of rape, as a consequence of which there is a guilt in the patient, then Sencris is one remedy which you should think of. Testosterone, we spoke about male pattern baldness. Now, folliculinum as a drug picture. There is an extensive proving of folliculinum in our Materia Medica. You can find it in Murphy's Materia Medica. The essence of folliculinum is that she feels controlled by somebody else. She feels out of sorts with her rhythms. She feels that she is leading somebody else's life, or she's just fulfilling somebody else's expectations. She's like a doormat. Okay, all these kind of feelings are very, very common in folliculinum. And I know that you can relate to a lot of women who talk to you about these kind of problems in their life. Okay, so you should think of folliculinum also as one of the important remedy for infertility, for PCOD and things like that. She feels that she needs to become the rescuer. She should do everything for all the people. She should rescue them, and as a consequence, she becomes drained. She has no individuality of herself. Okay, so here we find that it comes very, very close to carcinosin. Carcinosin again is a similar remedy where it can be used as an intercurrent remedy when there is history of cancer in the family. But folliculinum works when carcinosin is indicated and fails to act. Okay, so this is one remedy that you should think of. Now, this infertility case which did very well. So this lady consulted for infertility and varicose veins and dysmenorrhea. A detailed case was taken. Lacasis was prescribed. During the course of treatment, she developed vulvovaginitis and complained a lot of itching and curd-like discharge, etc. A pathological examination was done, and she was found to have candida infection. That is when she said that she has this very frequently. So candida albicans 30 was given for 5 days. The next one, she did not have any vaginal discharge. The period was normal. She was put on SL. Subsequently, the next one, she conceived. And at the eighth month of her conception, she had the infection again. So again, candida albicans 30 was repeated for 5 days, and she had a complete relief from the symptoms. Subsequently, she delivered a healthy baby boy. Again, candida albicans is a homeopathic remedy where the proving of this is available, and these are certain clinical conditions, etc., where you can use candida albicans as a homeopathic remedy. The other remedies, again, which I said I use, are thyroidinum, where there is a lot of thyroid issues. These are intercurrent remedies where we see that our other remedies are failing, and then we have to use these as an intercurrent remedy. Metformin is also available as a homeopathic remedy with Helios. So this is one new remedy which I am learning about, especially in PCOD with weight gain and insulin resistance. This case of a husband and wife who came to me, wanted to conceive. She had PCOD, husband had premature ejaculations. They had been taking treatment since 2015. She was on certain medication for PCOD problem. She would weep at the drop of her hat. She was not able to express her feelings. On the other hand, the husband had some issues because of which he had premature ejaculation. And so we studied their case thoroughly, and this is what we gave her. Okay. So the understanding in her case was that there was insulin resistance. She was overweight. She had PCOD. She had perspiration on the scalp. She had desire for sweets. So the remedy was calcarea carb, and syzygium was given 1x TDS for insulin resistance and bringing down the sugars to normal. The husband had a guilt, so he was given kali bromatum. He spoke about God will punish me for my deeds. Typically a kali brom expression. So 1M was given. These are their parameters when she subsequently conceived and she delivered normally. This is again a case of secondary infertility where there was partial tube block. She also had been to me because her daughter had asthma, so we put her on a typical protocol with homeopathy, yoga, diet, everything, and stopped her refined sugar and so on. And the medicine that we gave her was thiocinamin. So thiocinamin was given, and syphilinum was given as an intercurrent because she had repeated abortions also after the birth of her daughter. So this was secondary infertility. So we gave her syphilinum 1 dose and thiocinaminum 1x TDS for 2 months, which helped her to relieve the tubal block, and she subsequently delivered a baby girl. Okay. Now, this is another case which wanted to conceive, which had polycystic ovaries and typical growth on the hair growth on the face, etc. Reports, again, testosterone 1M was given, and 1 dose every month for 3 months, and she subsequently conceived after testosterone. So these are few cases which I wanted to share. Now, this is the last case which I would want to share, where this particular lady was talking about, very peculiar desires of pani puri and preferring the sea. Okay. So typical expression of medorinum. So she was given medorinum, and she had thyroid issues as well. So thyroidinum was given 1x BD, and she subsequently conceived. So yeah.
तिला एकूण आता आपण हे केलं ना, तर त्याचा काय फायदा झाला का तुम्हाला? काय ट्रीटमेंट आपण काय काय केली त्याचा? तिचं हिला आईला तिच्या.
So this lady came to me for a very typical history where she had abortions in the 5th month only. Every time she would conceive naturally, she would go up to 5 months and she would abort. So with a homeopathic remedy, she has been able to conceive. The child was born, was a little mentally backward, but she was happy about it because after 5
फायदा झाला का तुम्हाला? काय
trial,
ट्रीटमेंट
she
आपण
got
काय काय केली?
a baby.
तिचं हिला आईला
So after birth also the child was put in the NICU, but she survived, and the child is doing well now. She has caught up with her mental backwardness, and she is progressing well. The remedy she was given was sepia. Okay, because sepia is one remedy which has specifically abortion in the 5th month. Okay. So these are few cases which, I'm sorry, the infertility part I would have loved to cover in a greater detail. Maybe some other time we will cover it, but these are few remedies and things that I wanted to share with everyone. So I'm done. So if you want to ask some questions, I hope this was a good experience for you. I hope that you learned something new from this.
Dr. Abhay, I think you can stop screen sharing.
Stop. Okay, very good.
Yeah, yeah. And Dr. Dioshri can take over.
Yes. First of all, thank you everyone for attending this webinar. Most importantly, thank you, Dr. Abhay, for being such a great guide to all of us. And as he has rightly said, that the female is the seed for the future generation, and the need of the hour is to nourish and heal them holistically with the enlightening us with the importance of diet, lifestyle changes, along with proper nutrition, yoga, of course, healing them holistically with homeopathy. He has also told us about the factors that hinder with the hormones, such as environmental toxins, the OCPs, and the emotional issues. It was indeed a wonderful session with all the cases and their management, and we really, really loved your session. It was truly a learning experience, and we definitely wish to have more from you. Thank you so much, Dr. Abhay. Thank you for being with us today and enlightening us with all the knowledge you have. I'm sure there is more. We're waiting for more.
Thank you so much. There are no questions.
Yes, there are. So now we go on to the questions. Dr. Mamta has asked that with a lot of cases of PCOD, they have early menarche and it's a rising concern. So, if you treated any cases where there were early signs of puberty before 9 years to prevent early menarche?
Yes. So precocious puberty is one of the things that is really bothering us. I have uh, 3, 4 cases currently which I'm handling. All of them are doing well so far, but it's tough because it's not only related to it's a lot related to the kind of food that they are eating, and it's very difficult to prevent that. A lot of these precocious puberty children are eating a lot of processed food, stimulating their hormones a lot. Okay, so it is mandatory that we make their parents understand that don't give them milk, don't give them refined sugar, don't give them bakery products, cut off all these things, cut off all the processed food, the pizzas, the pastas, and so on. And you know take their history and give them the appropriate homeopathic remedy. So I have used remedies like phosphorus and pulsatilla very effectively in these kind of cases. But as I said, we need to be very, very strict with the diet part. We have to really drill into their mothers that it's not really healthy to eat all these things, because the kind of milk that we get, it is fully infused with a lot of oxytocin. you know I don't know what the situation in UAE. Of course, I know that there are possibilities where you get organic and this and that, but the awareness in patients is not there. So we have to put them on a specific diet if they really want to get out of this, and a lot of things that they are watching also. So it's not only the food that they are eating. You have seen the kind of changes that have happened in our television shows, in the movies and all that, which are impacting young girls, which are putting them into early secretion of sex hormones as well. So they are maturing very early. So we have to be careful about what they watch, what they read, what they eat, whether they sleep on time or not, everything.
Is triticum used only if there is gluten sensitivity?
No, but it is one of the main remedies for gluten sensitivity. That is what I have come to know. So, and we are coming across a lot of cases of gluten intolerance now. Okay. So, that is one remedy which I've started using for gluten intolerance or gluten sensitivity.
Okay, Dr. Soumya is asking if submissive yoga indication for LH surge, then can you repeat it? The indication
Yeah,
of utilizing
can you
harmonious
repeat the
movement.
remedy?
Yeah,
Yeah, you can repeat the remedy.
And also,
See, what I have learned is, now we have to slightly deviate from the thought that we give only one single remedy and that's it, and sit and watch what happens. Because the cases that are coming to us are complicated. They do require frequent stimulation. There are a lot of mixed pathologies that are coming. The kind of food that they are eating, the kind of medicines that they are taking for treatments of acne, and so many things. So you need to many times use certain remedies as drainage remedies or detox remedies, and you need to repeat remedies quite often, not just once and then wait and watch.
another question from Dr. Manjari. Prolactinoma is also the cause for amenorrhea. So, do you use any specific remedies for it?
Specific remedies, I have not had very good success with any specific remedy as such. But we have to, again, that is something which is very much related to, stress and so many other factors. So we have to take the entire case into account and then treat it. I have not given any specific remedy for prolactinoma.
Okay. And what is the role of constitutional medicines in inducing menses?
Yeah, so many cases where when we give the constitutional remedy and the case is not a very complicated case, it does induce menses. So there have been patients where you typically who come to you where there are maybe the PCOS diagnosis is there, but her food habits and her lifestyle is healthier. Then you can expect that just one single dose of that constitutional remedy can help those cases where, and it does. So simple remedies like pulsatilla, like calcarea carb, like sepia, all these remedies do help when they are indicated constitutionally and when the case is not very complicated. Okay. But when the case is a bit complicated, then you may have to give certain remedies as intercurrent, where as I said, let's say, for example, testosterone as an intercurrent remedy, but just one dose or something like that, so that the case moves forward and when it is indicated.
Okay, also there's a next question. Any specific medicines that you use for infertility after IVF fertility?
Yeah,
One
so
is
there is a
infertility and second is after IVF failure.
yeah, so
Failure.
there is a different protocol for it, and I will share it with you. It's a sort of a protocol that I follow.
Okay, please
Sure.
do. Uh,
Because that
Dr.
involves liver detox and uterine detox and things like that as well.
Okay. Dr. Veena is asking, have you treated any cases of endometriosis?
A lot, and they are a headache.
I
Okay.
guess probably that's
Because
why she's asked this question.
no, so the problem with these cases is, like recently I have one case who is trying to get on treatment for 3 years. Every few months she comes, she asks me few questions. She says, "Yeah, yeah, I will enroll with you, this, that," and she doesn't enroll. Because this endometriosis is again something which is a lot to do with their lifestyle. Okay, so they fail to understand that many of them come to us when they have already reached stage 4 endometriosis, and they expect that the treatment should help them immediately and everything should vanish. So in these cases we really have to use certain natural herbs as well. So again, endometriosis is a different topic which we can discuss in detail. So where we use certain herbal remedies along with the homeopathic constitutional remedy. We use something called as a castor oil pack, which we encourage the woman to use so that it resolves the internal adhesions and things like that. But they are difficult to treat, you know. But we have encouraging results, not that there are no results. It depends on which stage the patient comes to you.
Dr. Shabna is asking that, right, as you have mentioned about progesterone, so could you please put some light on estrogen?
I'll share the notes with you. There is a full proving about it also and when to use it as well.
Okay, and we'd also like to have your references, doctor, the books for drainage remedies or detox remedies.
Yes, yes, I will send you.
Okay. Another question is, where do you get your remedies like progesterone, Candida? Do you get it
Candida.
specially manufactured?
No, so some of them have been, St. George has started manufacturing some of them in India. So we can get them. And of course, Helios from London.
Okay.
They have all these remedies. Most of them they have.
Okay. Can you share something about secondary amenorrhea with PCOS? I quite didn't get the question what you wanted to ask
I
me.
think I already shared that.
Okay. Dr. Gossypium you had used in tincture form or was it
Mother
used in
tincture.
dispensing? Mother tincture.
Mother.
Also for triticum.
Triticum 30.
Okay. Okay, I think that covers all the questions. Okay, Candida albicans, which company medicine have you used, doctor?
I've got it from Helios.
Okay. So I think that sums all the questions for today.
I think only thing which people are asking whether mother tincture or potency and which potency like xanthosylum.
So again, xanthosylum I have used in lower potencies. So 12C or 30, maximum 30 I've given. Because in acute situations you often find that the lower potency helps more better, especially for pain management and things like that.
Okay. And I think there was a question on Triticum vulgaris can be used in general for gluten allergy. I
Doctor,
think
I've already asked that question. Yeah, I already asked.
so
Yes,
I think more or less
so
covered all the questions.
yeah, more or less I think all the questions are covered. Okay.
Okay. Anybody else, any questions they want to ask? You can ask directly also. If anybody has any other questions. Otherwise, we can just wind up the session.
It is fantastic to see that all the participants are still there.
Of course,
Dr.
of
Abhay,
course.
you kept them spellbound. And we
Oh,
definitely
thank
need
you.
another session from you. And this
Yeah,
time we would like you to take one topic at a time based on your experience. Let us say if you
yeah,
take endometriosis, whatever experience you have, and even
right.
we can make it interactive so that we can share our
Yeah.
experiences also.
Yes, yes, I would love that because see, learning never stops, and your observations, your experiences, that is the way to go ahead because all of us can't know every remedy. Okay, this, for example, the Kali Brome and things like that. Uh, I had never known that there is this kind of a symptom in Kali Brome. Okay. So we keep discovering every time. And I'm sure that if we come together, discuss maybe our successes and our failures also, we learn more from failures, I think. So surely we should once in a while get together and just, discuss things rather than keeping it only one sided. Surely I'm sure I'll be learning a lot from you all.
Okay. With this, we would like to end the session. And again, once again, I would like to thank Dr. Abhay for his insightful knowledge imparted to all of us, especially the keynote, tips that you have given us, the practical tips in relation to the minerals, vitamins, the herbs, and so many other to the point tips of homeopathic remedies to be given in female disorders. I think it was really helpful. So we really thank you and thank each one of you who took out time to be part of this webinar. And we definitely look forward to another one, maybe step by step, topic by
Yeah, sure.
topic, and many more to come. Thank you, Dr.
Yes.
Abhay, for taking out time. And thank you to all the participants
Thank you.
who were there today. And also with this, I would like to say that now, since In UAE, we have the break time, summer time. We'll be not conducting any classes or anything for next 2 months because everybody would be traveling. So we'll see you all in September. Okay. Thank you all for joining.
Bye bye.
Okay.
Thank you so much.
Yes.